In today's episode, we are going over 5 ways to combat quad weakness after ACL reconstruction surgery. Let's do it. So, why are we talking about this today? Mainly, we know this, but the quads get very weak after a knee injury, particularly with the ACL, but also with other injuries too. So, the meniscus, tendon rupture, that's a big problem because the quads will get weaker after you have the injury. And then when you get a surgery, they also get weaker for a period of time. We also know that getting strength back is very, very challenging after these procedures. So it makes sense that we're going to try everything in our power in order to get these back. I'm going to read this from a recent study. This is called Muscle Atrophy Contributes to Quad Weakness After ACL Reconstruction. This study was by, hold up, I can't even read it. It's too small. Thomas et al. In 2016. And what they said was that quadricep weakness is nearly ubiquitous following ACL injury and reconstruction. Strength deficits upwards of 30% in the reconstructed compared to contralateral limb have been reported 6 months post-operatively. And deficits in muscle mass symmetry are between 3 to 7%, 6 to 18 months after surgery. And some research is as high as 18% after 6 years. There's just a very long period of time where the quads simply aren't coming back. And in some individuals, the quads never come back, okay? So it stands to reason as physical therapists that we should be concerned about this. We're trying our best to get our patients' quads back after they have ACL reconstruction surgery. So in today's lesson, we're going to go over 5 strategies for rebuilding the quads. Now, what I will say is that exercise is always going to be number one for these folks. And I did an entire episode on how to utilize exercise, sets, reps, exercise selection to help in these people. However, in today's lesson, we're going to go over some additional treatments. And those treatments are 1, cryotherapy, 2, neuromuscular electrical stim, 3, blood flow restriction training, 4, biofeedback, and 5, contralateral limb training. So before we get going, I want to let you know about the Fitness Pain-Free Mini Course. If you're watching the recording of this, there'll be a link in the show notes. You can check that out. If you're watching this on Instagram or Facebook, you can go to my profile. Under the highlights, you'll see Fitness Pain-Free Mini Course to check out. We go over 4 different lessons, how traditional schooling has failed us. I love physical therapy school, but let's be honest, it doesn't teach you how to be an expert working in strength and fitness. Number 2, 7 reasons why people get hurt in the gym. If you have no idea why folks are getting hurt in the gym, it's going to be really hard to rehab them and get them back to train without hurting themselves further in the future. Number 3, 4 simple steps for getting your clients out of pain and back in the gym. It's very challenging. I think sometimes rehab is way too complicated and folks make it more complicated than it really is. I'll make it much more simple for you, break down a few easy steps so you can do it, right? And lastly, how to build the career of your dreams and earn the respect of your community. Now, I'm definitely one of those folks, but I love continuing education. I really like learning. But I think the deeper reason why I like learning and others like learning is because we want to have value to our patients. We want our patients to respect us. So I'll teach you how to do that, kind of begin towards that journey. And lastly, if you enroll into the Fitness Pain-Free Mini Course, you'll actually be pre-enrolled into the Fitness Pain-Free Certification. Now, the Fitness Pain-Free Certification is the most in-depth course certification that I offer at Fitness Pain-Free. It's actually open for enrollment right now. So if you're interested, I'd say definitely check it out, right? This is my university level education for working with folks in the strength and fitness realm. If you want to get on a wait list so you can get pre-enrolled into the next enrollment period, then go to my profile, check out the Fitness Pain-Free Mini Course. You'll automatically be enrolled. But if you want to check it out right now, it's actually open for enrollment. But do keep in mind, it's only open for enrollment for 1 week, 4 times per year. But currently it's open. So let's get going. Number 1, cryotherapy. And this is kind of a cool piece of information that I think a lot of folks don't know is creeping around in our medical literature. But after you have ACL reconstruction, normally the quad is inhibited, right? Now, we're not exactly sure why it's inhibited, and this lesson is not about diving into that, but one of the things can help bring the quad back and help it to fire a little bit better is going to be icing the knee, more specifically. So in this study by Joseph M. Hart et al., this is 2014 study, but since then there's been some more recent studies as well. What they did is they iced people that had ACL reconstruction, their knee, for 20 minutes and then performed exercise. And they compared this to a control group that was getting only ice and another control group that was getting just exercise. And what they found was performing the cryotherapy with exercise was superior to the cryotherapy group and the exercise alone group, right? And their outcome measures were maximum voluntary isometric torque. So basically, how hard can you push with your quad? One of the major limitations of the study is it was just a 2-week period, right? And as we'll see in some of these future treatments, they tend to have a short-term benefit, but the long-term benefits, we don't really know what they are, or they're not better than just performing exercise alone. So take that with a grain of salt. But what I will say is that I've been trying to have my patients ice prior to exercise if they can, right? So if they're able to come a little bit early or ice before they come to physical therapy, then I think that's probably beneficial in the very early stages after ACL reconstruction. It's just one of those things can kind of help push people in the right direction. Number 2, neuromuscular electrical stimulation. So if you've never heard this before, you basically take electrodes, you put it on the quad, and then you stim the quad, right? And to be honest, the initial studies, I think they're mostly coming out of Delaware, about how much stim you're supposed to use with these folks. It's a lot. I believe what they did is they put stim pads on someone's quad after ACL reconstruction, and they turned up the stim to the point they were pushing at 50% of their maximum, right? Basically, if you sit the knee at 90 degrees and push into something stationary, you push as hard as you can, you measure what that force output is. Let's make up a number, say it's 100. You'll have that patient relax. And then when you turn the stim up to the point where it makes the muscle contract and push with 50% of the force that you had just found. So it's a very, very high level of stim. Okay. And the conclusion to this paper right here, and this is a paper by Hauger et al., and this was 2017, is that NMES, in addition to standard physical therapy, appears to be significantly improved quadriceps strength and physical function in the early post-operative period compared to standard physical therapy alone. So basically, it seems to be a decent adjunct to your exercise, right? Do it with your exercise in the early stages of ACL reconstruction, right? Makes it a little bit more effective. Number 3, and this is a personal favorite of mine. I tend to use blood flow restriction training a lot in my practice. Blood flow restriction training. And in this study, this was a 2022 paper from the International Journal of Sports Physical Therapy by Koch et al. It was titled "The Effect of Low-Load BFR Training After ACL Reconstruction, a Systematic Review." Results of this systematic review indicate that low-load BFR training after ACL reconstruction may be beneficial in quadriceps strength, mass, and knee joint pain compared to non-BFR training with non-detrimental effects on ACL graft laxity. And they kind of said that more research need to be taken underway in order to come up with the ultimate conclusion of whether or not you should use VFR. Kind of reading through the BFR literature myself after ACL reconstruction, one of the things I think you'll find is that in the short term, BFR tends to be superior than exercise alone. So BFR plus exercise versus exercise. But in the longer term follow-up, what you'll find is that most folks tend to kind of catch up. So let's say you use BFR in the beginning stages versus not using BFR. And at 6 to 10 weeks, the BFR group is doing better. But if you look at 3 months, 6 months further down the line, BFR tends to be about the same as exercise. So I think that at least in those studies, it is showing that BFR is going to be a decent short-term tool, but long-term, most folks will catch up. One of the things that I tend to think about is that you have those kind of stubborn folks that towards the end of their rehabilitation, they're still having deficits or they're having pain, right? And one of the thoughts in my mind is that if we started BFR early on, more stim early on, maybe some cryotherapy early on, would they be in a better place when they're 6, 7, 8, 9 months out, right? So maybe the majority of folks will do fine without BFR, but the other piece is that if you include it, are you going to help those few folks that maybe would have trouble in later stages? I don't know. I like to include it because I think it can be beneficial, but at the end of the day, I'm not sure. Number 4, biofeedback training. So if you haven't heard of biofeedback training, essentially you have these units, right? Kind of looks like a stim unit, and they have electrode pads on them, and you put them on your quad, right? And what happens is that when you flex your quad, there's a little unit that's going to tell you how hard you're pushing or how much muscular kind of activation is going on within the quad. And this is useful because it gives feedback, biofeedback to the patient when they're doing a good job versus when they're not, right? And the idea is kind of wake up this muscle after you've had ACL reconstruction surgery. And the biofeedback gives that real-time feedback if the patient is actually getting the job accomplished, right? So if they push and that number goes way up, I'm like, okay, let's do more of that. Okay. And if it's not going up, they have that feedback too. They're like, all right, this isn't working. Let's try something up. Let's change the cueing, try to flex this muscle right here. And it's really nice. And some of the research is showing that it tends to be effective in comparison to just exercise alone. So this is a study in 2012. It's called the influence of electromyographic biofeedback therapy on knee extension following ACL ligament reconstruction, randomized controlled trial by Christinell et al. And they were looking at biofeedback to the vastus medialis in exercise versus no biofeedback in exercise. And what they found, and this is interesting, but at 6 weeks, the knee extension range of motion was significantly improved versus control. So the stim actually improved range of motion, which is interesting because that might not be the thing you would think would improve the most. And at the 6-week mark, pain, swelling, and function was the same, right? So like I said previously, it looks like some of these people caught up over the course of time. But at 2 weeks, pain, swelling, and function was a bit better, right? So the thought process being is that this kind of helps you on in the early stages of rehab, and maybe over the course of time, people kind of catch up. But I think, like I said, long-term, there are some folks that don't get their pain levels down. They don't get to the point where the range of motion is back fully. So maybe this is a nice adjunct in the beginning to set people up in the long term, right? And lastly, contralateral limb training. What does this mean? So essentially, after you have ACL reconstruction, we can't do a lot on the surgical leg. However, you can definitely train the contralateral limb, and that's what this is. So in this study, they're looking at folks who performed contralateral limb training after ACL reconstruction versus folks that didn't perform any contralateral limb training, right? And what they found is that this helped to attenuate hamstring and quad weakness. However, this is in the short term. So at week 10, what they found is that the folks that were doing contralateral limb training, they actually had better strength, right? But once you get to the 24-week mark, so essentially after people have had a period of time to train both legs, they all kind of caught up, right? So I think it's important to just take all this research with a bit of a grain of salt, because it seems like these treatments are effective in the short term, but the majority of people will kind of catch up over the course of time. Does that mean you shouldn't include these treatments? I don't think so. My thought is that some of those stubborn folks that don't have great outcomes, 6, 9, 10-month mark, we may be able to improve their potential outcome if we do more of these, strategies early on. So what I will say is that I tend to use all of these modalities. It's challenging. You only have so much time to perform physical therapy. So you might have your patient do some icing before they start their exercises. Then you're doing some biofeedback. Then you're doing some NMES. You might be doing all of this with BFR. And then you do some contralateral limb training. It's just a lot to try to fit into a session. But at the end of the day, I think you probably can make an argument for those things, right? And I certainly do. So that's it for today's lesson. I do want to let you know about my Fitness Pain-Free Mini Course. Again, there'll be a link in the bio. If you want to check it out right now, you can go into my profile under the highlights under the Fitness Pain-Free Mini Course. If you're interested in any of the references, they'll be available in the show notes. I'll get that done a little bit later today, and it'll be available in the recording. And lastly, before I go, I just want to see if you guys had any questions. So I'm going to grab my phone and take a look. If you have any questions right now, feel free to put them into the comment section. Okay. And I'll just answer them as best I can. What's up, guys? Scroll. Good. What's up, Kevin? Boom. All right. Did patients in study wear a brace immediately following ACL surgery or not? I think this kind of depends on the study. If you guys didn't hear me, Stijna Baugh asked, did patients in study wear a brace immediately following ACL surgery or not? I just quoted like 5 studies, and I apologize. I'm not sure what study you're talking about. But I think in a lot of these studies, yes, I think it's mostly immediately weight bearing with a brace. But again, that probably depends on the study. If you want to maybe give a follow-up comment a little bit later, I can answer that a bit better for you. But anyway, it looks like that's it for the questions. Really appreciate you guys showing up. I always say this, but I have a lot of gratitude for you guys showing up and learning from me. It really allows me to do what I love for a living. So again, thank you and appreciate it. Last piece is that I will not be here next week. I'm going to be hanging out in the mountains of Georgia on vacation. So I will have a Fitness Pain Free show uploaded today and again next week. But I won't be doing the Ask Fitness Pain Free show because I just won't be around. But anyway, I'll see you the week following. I apologize. I'm sorry, I got picking up a question right here. Wrote 2, please answers. Okay. I don't know why I'm not seeing your question. Okay. Hello, sir. Thanks for your guidance. Yep, you're welcome. Thank you. I'm not seeing the question. I wrote 2, please answers. Oh, how early should we start rehab? To be honest, this is something that you should probably talk to your surgeon about, and it's really going to depend highly on whether there's concomitant pathology. So was there a meniscus tear? Was there a meniscus repair? Was there multiple ligaments involved, right? But we're starting physical therapy very quickly after surgery, so several days. But it's obviously going to depend a lot on the patient, the surgeon, and everything else. So yeah, sorry. How early should we start? How am I don't know, maybe elaborate a little bit more on that question. I had ACL with meniscus. Okay. Well, I can't give you medical advice, and I apologize, but it's not a good idea for me to start doing that. Doctor said 2 weeks post that. That sounds good. Talk to the doc, talk to your physical therapist, and come up with a game plan. If you want some, information about how I tend to rehab these, I have a whole bunch of Fitness Pain Free show episodes where I talk about how I do rehab. But again, you can't just go off of that. You have to listen to your doc. You have to listen to your physical therapist. Okay. That's going to be super important. So, all right. Hope that helps. Garamahathi, let me know how your rehab goes, right? If I can help, let me know. Anyway, thanks again, guys. Appreciate it. And I will see you guys in 2 weeks. All right. Have a good day.